right, let's take a look at how to increase some of your shoulder range of motion if you have any limitations from any conditions, such as like a frozen shoulder, or if you're further a little bit long down the line after like a shoulder surgery of any kind. You always want to make sure you speak with your therapist or your physician, making sure you're not doing something you shouldn't do. But on the whole, these are pretty safe to do. The first thing you're going to want to do is try and do some of this pendulum activity, okay? Now with this pendulum or Codman exercise, I'm not stirring the pot here. It's just like a nice, loose and easygoing kind of rotary motion happening at the shoulder, okay? The arm, the weight of the arm is kind of pulling down, is causing a little bit of traction, which is going to help with some lubrication of that joint itself. So I always start with a minute or two going each direction. And if you kind of want to move the hips a little bit, so you're not necessarily like stirring the pot, just kind of move the hips a little bit just to kind of help with that movement, okay? So that is, again, the pendulum or Codman. I'm going to start there. The next thing you can do is grabbing some type of cane, and you can just straight up do the motions. You know, you can just lift, active assisted, okay? So you can just lift like here, and a lot of times what you can see is some hike, and try to minimize that shoulder hike. So if you need to start this on the bed, so you might want to just start it out like so, and just try to lift as far as you can go here. This is a good way to really start that out, okay? So going into flexion. Then you can also do some abduction. Grab this hand, this is my affected shoulder here, and then you can take this other hand and push it out into abduction, okay? So you got like a guitar grip here, and pushing that out like so, all right? So you're working on abduction there. You can start here for some external rotation, okay? So elbow is glued to the side, and then also on the table, pushing that out, okay? You can also start that shoulder at 45 degrees and try to go up like this. You can also do this in a scarecrow, what I like to call scarecrow fashion. So you're grabbing here, like you're trying to reach over your head and scratch the back of your head, okay, like so, right? So that's how that one looks, okay? And then this next one is really going to be done more so in standing or seated. And I'll just hold this like so, okay? So you want to work on a little bit of extension, okay? And also you want to work on some internal rotation. So you want to bring this up like so, okay? All right, so bring that up the back. Once, I like to start my patients out like so, and then once they get a little bit better at increasing that range, they don't have as much pain, bring your hands closer together, and you're bringing that up like this, okay? So you've got that internal rotation. So you can start all those on the bed first, and then progress those to either seated or standing. So try to get it as high as you can, try to minimize that shoulder hike, okay? Don't let that shoulder hike up. So you got flexion, get that up. Again, this will be my affected arm now, okay? Guitar hand grip, like you're playing a guitar, okay? And you're going to bring that out to the side, right? Bring that out to the side. You can also do some external rotation or lateral rotation, keeping this elbow glued right to your side, bringing out so, like so, okay? And I like to bring that shoulder, once you kind of get things moving in that direction, go ahead and do it like this as well. This is the one I like to call the scarecrow, but it's in sitting or standing. Bringing like so, okay? Again, this is a good functional movement, trying to get you so you can wash the back of your head. And again, that other one, trying to reach in the back of your pocket, bringing this up like so, okay? All right, so those are all the active assistive kind of motions that you can do to increase that shoulder range of motion. Now the next one I want to show you here is that posterior capsule stretch. So this is also known as like the sleeper stretch. So I'm gonna be at a 90-degree angle here with my elbow here, okay? And I'm gonna go ahead and try to reach this down as far as I can get. Some people, they can only get about so far. You wanna try to just do whatever you can tolerate without increasing your pain too much. A modified sleeper stretch is sometimes this weight being on the upper arm here, onto that humerus might be a little bit too much. So you can kind of open up a little bit. See how I open up my torso? So I'm kind of facing the ceiling a little bit more. And you should notice I should be able to get much more range of motion this way, okay? So if I'm fully on the shoulder itself, yeah, that's about as much as I'm gonna be able to get. So you can, again, open up the trunk a little bit. That should help, okay? Also, a way to modify this is don't put it at 90 degrees, okay? Bring that arm down like so. And now, I mean, look, I'm still rolled over and I can get down quite a bit further. And then even so, if I have pain with this, too much pain with this, if I open up, I mean, I can get right down, no problem. So again, really, you wanna try to get your weight onto that shoulder and try to pull that down like so, okay? So that's a good way to do that modified version of that sleeper stretch, or just the straight up sleeper stretch. Those are fine. And you can do the cross arm stretch as well. So just bringing your arm across and holding that. And then the last one I really want you to try is to increase that range of motion. So this will be my affected arm here, since this might be a little bit easier to see. I'm gonna go ahead and put this belt behind me, and I'm gonna grab the belt, okay? And I'm gonna pull it over my shoulder. So this is the arm that's gonna be working. And I'm gonna pull this up kind of as much as I can tolerate, okay? And all these stretches, I might start out by doing like 10 seconds each, trying to progress to like 30 seconds, okay? And I'm just gonna pull this just like so. All right, and again, holding that for starting out maybe like 10 seconds, or just doing the repeats is good to start out as well. Progressing those to only doing for counts of like 10 seconds or 30 seconds, and then as you get a little bit more tolerable to the stretch, advance it to like a 30-second hold. And that can be said for the same for the sleeper stretch. Just getting into the position sometimes can be too much and too aggressive for your patient, for your patient or for you. And then as you can tolerate more stretch and more range of motion, and you get better with less pain, go ahead and extend that time to 10 seconds, to 15, to 30, whatever you can come to tolerate. Hope this will help out your shoulder range of motion issues.